Let me. All right, go ahead and read it.
You are dispatched to the motocross track where a 23-year-old man lost control of his motorcycle while attempting a jump and fell over the handlebars. Upon arrival, you find the patient lying on the ground in the care of first responders. He denies any loss of consciousness and can recall the events leading up to, during, and after the incident. He complains of severe pain to his right upper leg. You note severe deformity and swelling to the area.
Cool. All right, I'm going to have my proper PPE, be wearing gloves. I do have to ask if my scene is safe. Is it safe? It should be on the top.
Yes.
Okay. I also have to ask how many, my mechanism of injury is patient fractured leg, possible fractured leg in a motorcycle accident. I also have to ask how many patients do I have?
Just one.
Okay. And I would need to initiate, or I would actually call ALS. This seems pretty important enough, and also initiate C-spine position so you don't create any further injuries to your spine. So just straighten you out. Perfect. All right. My patient's chief of complaint is a pain to his upper right thigh. Oh. And how is my patient's responsiveness? I do have to ask that too.
His responsiveness is
gonna be his level of consciousness.
He is responsive and answers questions appropriately.
Okay. All right. So we're gonna go ahead and assess your airway. We're gonna go and make sure his airway is clear and that he is breathing properly. How is my patient's airway?
Airway is open and patent. No trauma noted.
Okay. So that means we don't have to insert an adjunct to keep your airway open. So you're all good. My patient's breathing, I'm going to be wanting to listen to his lung sounds and making sure he has clear breath sounds. You want to just breathe normally for me? All right. And how are my patient's breath sounds?
Normal rate, non-labored, equal rise and fall of the chest. His lung sounds are clear, and his SpO2 is 99%.
Okay, so I probably wouldn't initiate any oxygen therapy because he does have a high oxygen rate right now. We'll assess that later in case his SpO2 does lower. Move to the other side. I'm going to be checking his circulation. Make sure you have a pulse. And how's my patient's pulse?
Radial pulses are strong, regular, and equal.
Perfect. How's my patient's color, temperature, and condition?
Warm, pink, and moist due to the environment.
Okay. So we're good there. And any major bleeding?
No major bleeding seen.
Okay. And he doesn't have any signs of shock, so he's good. His skin is perfect. Then we're going to go ahead and check his blood pressure, his pulse, and his respiratory rate.
What about the pain in my leg?
Oh, we'll get to it soon. Oh. Don't worry. Don't worry.
Please.
Alright. I'm going to have you just lift up your arm slightly for me. Thank you. Alright, does that feel too tight?
Oh. Nope.
Okay, perfect. Alright. right, my patient's blood pressure is 99 over 149. What's the actual blood pressure?
122 over 84.
All right. We're going to go ahead and check your pulse, sir. His pulse is 98 and his respiratory rate is 18. What's my actual patient's pulse and respiratory rate?
Pulse is 84, respiration is 20.
All right. Okay, we're going to go ahead and take his history. Does my patient have any, what's his major symptoms? Yeah, just the back. Or it's in the front, technically. It's a sample.
Okay. Obvious deformity to the right femur.
Mm-hmm.
Had lunch approximately 2 hours ago. Racing and motocross event when he lost control.
Oh, are you reading at each line?
Yeah.
Okay.
Am
I just need the S.
I am so sorry.
That's okay.
Obvious deformity to the right femur.
Okay. Any allergies? Which is A.
Now I get it. No.
Okay. Medication that he's taking?
No.
Okay. Any, what's the pertinent past medical history?
None.
Okay. His last oral intake?
Lunch approximately 2 hours ago.
Okay. And then his events leading up to this?
Racing and motocross event when he lost control and flipped over the handlebars.
Okay. All right. We're going to go ahead and do our...
How's my bike?
Oh, your bike is great. It looks
thank you.
just brand new. Don't worry.
All right, yeah.
Okay, we're going to go ahead and start palpating. We're going to do a head-to-toe assessment. I'm going to palpate and inspect his head. And we're going to check your ears. Looks good. Can you open your eyes for me? I'm going to be shining a light. Check if they're reactive. Can you open your mouth? All right. And your nose looks good. Okay, we were checking for any cerebral spine fluid or any blood or deformities. Does my patient have any of those?
No injuries, blood or cerebral spinal fluid, no battle signs or raccoonitis.
Okay, perfect. We're going to go ahead and check the neck. We're going to make sure if there's any cervical spine issues. Check for jugular vein distension and if his trachea is distended. How is his neck?
No JVD, no tracheal shift, no obvious deformity.
All right, perfect. You're looking good so far. We're going to go ahead and palpate his chest. I'm going to just press down a little bit hard on you. If you start feeling uncomfortable, let me know. Are you ticklish? Okay. All right. I inspected and palpated his chest. Let's check for your lung sounds too to make sure they're still good. All right. How's my patient's chest?
No injury noted. Breath sounds are clear and equal.
All right. That's perfect. Okay, we're going to go check down the abdomen. We're going to inspect and palpate all 4 quadrants. All right, and we're going to also check the pelvis to make sure he hasn't broken his pelvis. We're going to be careful. All right, and I'm gonna say I already checked the patient's genital area. So how's my patient's abdomen and pelvis?
Stable pelvis, abdomen soft and non-tender in all 4 quadrants. No genital injury.
Perfect. Okay, then we're gonna go check all extremities. I'm gonna start with his arms. Palpating his arms and making sure if there's any injuries. We're going to check his motor functions. Can you wiggle your fingers? And tell me which finger I'm holding.
Pinky.
Perfect. I'm going to carefully go around him, check his other arm. Palpate it. Inspect it. Perfect. And can you wiggle your fingers again? Perfect. Which finger am I holding?
Pointer.
Perfect. Okay, do a note to make sure to not touch his injury on his right leg. So we're going to just start with the left. We're going to palpate it, inspect it. Perfect.
You got the wrong leg. That's my broke leg.
This is broke leg. I don't know my rights and lefts. Okay.
Boy, that hurt. Ow,
Oops. Sorry, that was the wrong leg. Okay, let's do this again. That's all right.
Just check it.
That's okay. As long as I'm doing what I need to be doing.
Funny.
Okay.
That's wrong.
Go, wiggle your toes for me. Perfect. Which toe am I holding?
My big toe.
Okay. All right. I'm gonna just gently touch your top of your leg.
Oh, ow.
Oh,
ow,
okay.
ow.
And then we're gonna go down. And go ahead and wiggle your toes. Which toe am I holding?
My big toe.
Okay. We would check the back as soon as we had ALS come. I don't want to move him in case he does have any more injuries to his spine. And in case I'm here by myself, we would want to recess our patient every 5 minutes because he is in a critical state. And we would also want to immediate transport as soon as possible. I would also take my vitals again every 5 minutes. That's it.